Hey there. Welcome to another episode of Health and Faith Chat with MP Chinedu. Today we're going to talk about a lab that you may or may not be aware of. It's called Quantiferon-TB Gold Test. Have you ever heard of that? Well, what is it? That's the question we need to ask. It is a test that is often done. It's a blood test that is often done to detect the bacteria that causes tuberculosis. And this test can sometimes be substituted for a chest x-ray if there needs to be an assessment if the person has tuberculosis exposure or disease or just infection going on. So it can also be substituted for the PPD, the tuberculin skin test. I don't know if you guys remember if you work in health field where you would go take the tuberculin test and you have to go back in 2 days and there will be a reading done to see if it's positive or not. And so you can do the Quantiferon-TB Gold as a substitute for either a chest x-ray or PPD, tuberculin test, to do the same thing, to basically help detect if there is tuberculosis exposure, or if the bacteria, if you have been exposed to that bacteria. So most of the time that test is sufficient for many places. When do you need this, or who would require this? This is often a requirement, maybe in the workplace, and sometimes in schools. Often colleges will require the student to test this yearly as part of their wellness check, to make sure that they don't have tuberculosis exposure. So it is really convenient, because sometimes the chest x-ray may take a while to get it scheduled, or the tuberculosis, the PPD may, the time to go back and forth to have it read. And also sometimes there is a false negative, a false positive. So it's just another convenient way to help detect the bacteria that causes tuberculosis by performing the Quantiferon-TB Gold, okay, or QFT. I wanted to just talk about that today. Maybe some of you are not aware that such a test exists. And to invite you, if you need that test at our Point Labs, absolutely we can help you, because it's just a quick test. And you would get the results as quickly as possible. So wanted to talk about that today and give you that option. But I will say this, if someone has the Quantiferon-TB Gold test done and continues to have symptoms where there's need further inquiry, of course proceed with the chest x-ray to be sure to detect if there is actual tuberculosis in the lungs. You will want to follow with the chest x-ray. But definitely, if you need a Quantiferon Gold test, a lot of time, most places that's sufficient for what they need to check you for tuberculosis exposure. So, because a lot of times when you talk about false negative and false positive, you can run into sometimes it is when that test was done that you may be, just like any illness or virus, you may be exposed at that time and it has not started to, has not gone to become active, but you may have the exposure. And depending on the time that the test is done, has also something to do when we detect if it's active or not. That's why most organizations and school, etc., require you to do this yearly wellness check, right, to make sure that we continue to check to make sure that we don't have anything going on, so that we can fix it. So I'm here today to tell you that such a test exists if you didn't know about it already, and that we are here to help. Okay, until next time, have a wonderful rest of the day. Bye-bye.